Hello, and thank you for tuning into McDougall's Medicine with Dr. John and Mary McDougall. I'm their daughter and your host, Heather McDougall, and we're going to get to general questions tonight. But first, I know that Dr. McDougall, Dad, you have a number of studies to get to. So hello, Mom and Dad. Nice to see you. How are you?
Well, good. And by popular demand, because of your request, what I want to share with you are the things that have caught my attention over the past week. And these would be scientific research, which we're going to provide for you in the chat for you to take a look at. But let me tell you some of the things that I got kind of excited about this week. Do you see the presentation okay, Heather? All right. So what we're going to talk about is we're going to talk about three different subject areas today. And some of you are concerned by the fact that my books, newsletters, etc. The last one was published in 2011, but of course I keep everything up to date in the videos I do. And yeah, I know you're a little worried, but I've tried to set you at ease. The truth don't change, folks. If it's true, it's going to stay the same. So let's take a look at some of the things that I've been telling you over the last, 47 years, but you probably listened to me on this presentation for the last couple of years. All right, I want to talk about estrogen, vaginal estrogen creams. I want to talk to you about vegetarian diets and COVID-19. I want to talk to you about screening. All right, well, estrogen promotes hormone-dependent cancers. You probably know that, like breast cancer and uterine cancer and so on. And so as a result, you want to be very, very careful about the estrogen load in a woman who has, say, breast or uterine cancer. And one of the things, of course, you can do is you can eat a healthy diet. Women who eat like we do have about 50% lower estrogen levels than women who eat the typical American diet. And they get these estrogens from their bowel bacteria and from what they eat. And, also they get it from milk. Milk has a load of estrogen in it because of the farming practices. And those farming practices they milk pregnant cows. Yeah, so you get a whole load of estrogen there. Well, you probably know, if you're involved in breast cancer in any way, that one of the primary focuses of attention is to block estrogen effects on the breast and probably the uterus. And we do that with drugs like tamoxifen, aromatase inhibitors, removal of the ovaries, which all prolong survival in a woman with, say, breast cancer. A chemotherapy works basically because it kills a woman's ovaries. There are kinder ways to castrate a woman than to give her toxic drugs that make her go bald and throw up for a long time. So anyway, I know you're concerned about estrogens and their effect that they might have, but you're also concerned about the vaginal tissues, dryness. Maybe you're still involved in sexual activities, and you'd like to have a little help when it comes to treating the vaginal tissues locally. And so, I've been aware of this data for many, many years. What's important for you to understand is there have been a couple of big tests done where they've looked at the effect of giving women with breast cancer vaginal estrogens and whether or not it resulted in them having an increased risk of dying or not. And the answer is no, based upon this particular study here. But while I was looking for this particular study, I found something else interesting. It is a interest in men to stay as young and have as much libido as possible. And so it's kind of seductive to think that what you can do is take testosterone to give you your youthful sexual drive back. And so, there's a big temptation for that. There's a big business in that. I've tried to warn you that it really doesn't do much for libido, and you have an increased risk of dying of heart disease. And this particular study that just came out, I'm showing you studies in 2024, just came out in the New England Journal of Medicine, shows that when you supplement testosterone for men who have low testosterone levels, you increase fractures. So more heart disease, more fractures, not a really big showing, good showing in terms of improving your interest in sexual activities. Okay, COVID-19 and comorbid factors. That is another particular study that caught my attention. And let's start in the beginning here. We've been talking about COVID-19 since the year 2000 and 2019, 2020 for sure. came from China. People in China knew before it even arrived in the United States that if you had comorbid problems, comorbid diseases like heart disease, kidney disease, obesity, etc., you are in a category where you have an increased risk of hospitalization, ending up on a ventilator, and dying. All right. So this was known even before COVID came to the shores of the United States. The Center for Disease Control has come out with a statement that if people who have comorbid factors, these are diseases that people get from eating the kind of diet that's gotten you in trouble, the kind of diet where we solve these comorbid conditions. We reverse heart disease and diabetes and obesity, et cetera. Anyway, what they report in the CDC is that hospitalizations were 6 times higher in patients that have comorbid factors, obesity, heart disease, et cetera. And death is 12 times as high. So there's research from across the pond and in Europe where they state the same things. For example, the British Medical Journal, they came out and told the public, look, if you want to not end up on a ventilator, hospitalized, or dead, then what you ought to do is eat a diet that's rich in whole grains, fruits, vegetables, and legumes. So what caught my attention was an article that came out that shows that vegetarians who solve comorbid factors, which is what they do, vegetarians have a decreased risk and severity if they did develop a COVID infection. So you may find that article particularly interesting.
Well, it says even in the elderly.
Particularly in the elderly. Yeah.
Well, that's good.
Yeah. Okay. All right. Let's talk a little bit. This is the last subject, but I know I'm going to have to go into a little bit of detail. So pay attention carefully here, because the end of this short presentation is going to help you understand that I've been talking to you about science forever. The truth don't change. Let's take a look. What we have is we have doctor-patient relationships. One way we can establish a doctor-patient relationship is you could get sick, you could come to me, I'm a doctor, and ask for help. In that case, the evidence that I'm going to help you doesn't have to be all that great. The other possibility where we can develop a relationship is I can come looking for you. And that's what screening programs are all about. Ma'am, you got to check your breast. You got to have a mammogram. Sir, you got to have a PSA test. You're enjoying the garden, your grandkids, your pinochle games, and life is good. But I tell you, you have to get these things done. This is called disease mongering. This is turning people into patients. And that's what screening programs do more effectively than anything else. The point being is that if these programs don't work, it ought to be told to the public. And there should be no question that if I'm going to initiate the relationship and ask you to get involved, in other words, disease monger, that there should be no doubt that these screening techniques are going to do you more good than harm, don't you think? I think so. All right. So anyway, we have all kinds of screening programs, and your doctor is the intermediary between you and the testing, colonoscopies, mammograms, PSA testing, and so on. And so this particular research went out and asked doctors if they understood the benefits of these tests, and in this case, particularly mammograms. They asked physicians, general doctors, do you understand the value of these tests? And the doctors came back and said, yeah, they improve survival. In other words, you live longer before you die. All right. The other thing they said is that increased number of tumors found is a reason to do mammography. But these two reasons are incorrect. It was pointed out and scientists know this, medical doctors know this, the real value and the only value you can show in terms of screening technique is you have to show reduced overall death for those who have been screened. All right, let's take a look at this in some detail. The idea that if you live longer from the time of diagnosis, that this is an advantage to screening. Well, consider, here's the day you die day 0, all right? So say you're not looking for your cancers in the breast, colon, prostate. You may find the cancer, say, 3 years before you die. Okay, so you only live 3 years. But say you start looking earlier, using mammograms, PSA tests, and so on. Then you find it earlier, so you live longer. but you still die the same day. You just live longer knowing you're sick. That's it. The idea that if you survive 5 years, you're cured. Well, it's the time of death is the same. And whether or not you live 5 years is really just a matter of whether or not, how early you find it, because the day you die is not been changed by these screening techniques. And I know you're a little upset now. You don't think this is true. Anyway, the other thing that doctors believe, which is incorrect, is that if you find more tumors, that's the patient's advantage. But when you add up the number of tumors found during a woman's life with those found at autopsy, you compare that with women who weren't involved in early detection techniques, the number of tumors is the same. Yeah. And the only way you can really say that screening technology works is that you screen one group of people, that's the intervention group, compared to a control group. And the intervention group, you have more people alive at the end of the study by doing the screening tests than those who are the controls. But what I'm here to tell you is this is not the case. I don't know of any screening test except for a sigmoid exam, we'll get to that, which reduces the overall mortality. All right, mammograms. I've been very interested in the subject of breast cancer my whole career. And I've studied carefully the studies, the mammogram studies, and there are, eight studies done. Two of the worst studies done, in other words, less reliable studies done, show benefit. But more recent studies that are more carefully done show no benefit at all. In fact, the Canadian study actually showed that young women who have mammograms have an increased risk of dying. Now, Charles Wright and C. Barbara Mueller, they happen to be a couple of my mentors. They wrote an article in 1995 about screening mammography. They said, since the benefit achieved is marginal, the harm caused is substantial, and the costs incurred are enormous, we suggest that public funding for breast cancer screening in any age group is not justifiable. Ladies and gentlemen, this was about 35 years ago. All right. Well, the Cochrane collaboration has had a chance to look at this topic very carefully. And Peter Gertzke, he happens to be another one of my mentors. He wrote a book called Mammography Screening, Truth, Lies, and Controversies. And what the Cochrane collaboration has come to the conclusion is the following, and it's stated in his book. Now, I would encourage you to get this book if you're having any arguments with your particular doctor or friends or relatives. Read the research. I had a chance to read this research, so I know what it says. What it says is that women who are screened, it doesn't save lives. Mammography doesn't save lives. I'll show you the actual numbers in a minute. It increases the number of overdiagnosed and increases the chance of having a mastectomy. This should be obvious to you. Okay, well, what the Cochrane collaboration, if you look at the data and carefully, what you find is the following. If you screen 2,000 women with mammograms, you may benefit one by her avoiding death from breast cancer. 1 in 2,000. I know if you're the 1 in 2,000, it's worth it. But how about the other 1,999 women? Okay, what happens is that some of these women, quite a few of them diagnosed as breast cancer, die of something else first, like old age. And this is called overdiagnosis. When they find a cancer, tell you got cancer. You can't get life insurance, can't get health insurance. People say breast cancer before they say Marge. They say prostate cancer before they say George. In other words, it changes your life. The chances of being overdiagnosed in 2,000 mammograms is 10 healthy women will be told that they have a disease when they really don't. That's overdiagnosis. But that's conservative numbers. It's as high as 50 out of the 2,000. And you have to, going on for further testing, according to the Cochrane collaboration, 200 healthy women will be told that they have a problem. They have to go through further testing. Anyway, the Cochrane collaboration put out a brochure in 2012 in 13 languages. You have to understand, Cochrane is one of the most respected organizations in the world. They say, it therefore no longer seems reasonable to attend breast cancer screening. Yeah, okay, you getting the gist of things? All right, well, as far as overdiagnosis is concerned, I want to show you an article that just came out, February 2023. Look at your chance of overdiagnosis. In other words, you get mammogram, You're told you have cancer, but the cancer is not in any way life-threatening because you're going to die of something else first. Competing causes. The chance of being overdiagnosed is, out of 2,000 mammograms based on Cochrane, 30 to 46 women will be overdiagnosed. And if you happen to be an older person, say age 70 to 74, then 1/3 of the time that you're told you have breast cancer, you really don't. And if you're in an even older age group, you have a 50-50 chance. You're overdiagnosed. You can see the risk of having this particular test done. You're no longer a patient, excuse me, a person. You're a patient with all the baggage that's associated with it. So, the benefits ought to be there with no question at all. This is how often that women risk overdiagnosis when they submit themselves to mammograms, similar things with colonoscopy, similar things in terms of PSA testing for prostate cancer. All right, the reason is this, and we're kind of getting to the end of the presentation now, is because of the natural history of the development of cancer. And if you're really interested in the topic, I want you to learn the natural history so you understand why local treatments, like, for example, surgery to remove the cancer of the breast or radiation to radiate the cancer in the breast, can't possibly work. If you understand this, you understand why early detection is really late detection. That's why you don't see the benefits. Let's start, okay? In a single breast, you've got 100 billion cells. Two breasts, 200 billion cells. One cell leads the way. It gets damaged, let's say, chemical toxins and carcinogens, damage that cell, and it starts dividing in its own free will. Cells aren't allowed to divide at their own free will, or you'd be a misshapen lump in a matter of hours. So if you're growing or you're repairing wounds, cells are allowed to divide. But these cells get injured and they stop obeying this basic rule. You can't divide at your own free will. All right, this is the average doubling time. In other words, from one cell to two to four. The average doubling time is every 100 days. So take a look at what happens in a breast that contains 100 billion cells, or a single prostate, 100 billion cells. You start with one cancer cell, 100 days later you have two, 3.5 months later you have four, etc., until you've had cancer for a year. Now you have 12 cells, 12 cancer cells lurking in a breast that contains 100 billion cells. Nobody's going to find that. Yet you've had cancer for a year. The divisions continue, and at 2 years, you got maybe 100 or 200 cells in this particular tumor. You have to wait until 6 years of growth on average until the tumor mass, with the slightest chance of finding a tumor mass, a tumor mass that's 1 millimeter, which contains 1 million cells, it takes 6 years of doubling to get to that point on average. And then when it comes to finding a tumor big enough, it takes another 4 years on average. It takes 10 years before these tumors surface their ugly heads and tell you that they're there. Okay, 10 years. It takes 10 years before a PSA starts to be positive. For mammograms, it takes 14 to 17 years on average before a tumor is detected, from the time it starts till the time you find it. Okay, so the reason mammograms find later disease is because it's slower growing disease. Anyway, here it is, folks. You read it. Look at the study. It just came out, JAMA Internal Medicine 2023. You really need to understand and look at this study. This is estimated lifetime gained with cancer screening tests, a meta-analysis of randomized clinical trials. In other words, when they looked at the various trials of screening, mammography, colonoscopy, sigmoidoscopy, checking the stool for blood, checking the stool for genetic material, etc., screening for lung cancer in smokers, doing PSA tests in men for prostate cancer, they found no survival benefit except for when it comes to looking for colon cancer with a sigmoid exam. Come on now. This is the truth. This is late detection. You end up, it destroys your life to undergo this early detection screening. I know that I must sound like a crazy person.
Yeah, nobody believes that.
Read the research, ladies and gentlemen. I've been telling you this for 40 years. Same discussion. I showed you C. Barbara Mueller, Charles Wright, Peter Gursky. I've taken you back 40 years to show you that we've known this forever. Here it is, 2023, November of 2023, a couple of months ago. A meta-analysis coming to the same conclusion. Early detection does more harm than good. You become a cancer victim with no survival benefit, except for probably sigmoid exams. That's a whole nother discussion. But yeah, I think with a sigmoid exam, you're likely to reduce your risk of dying of colon cancer, but not with a colonoscopy.
And make sure they understand the difference between a sigmoidoscopy and a colonoscopy.
Well, a colonoscopy is done with a 6 to 8 foot long tube. And what happens is if you save a life, say by removing a tumor from the colon, you end up killing another person because this 6 8 foot tube causes perforations and bleeding, all kinds of problems. So for every life saved, you end up killing somebody. Same thing whether it comes with breast cancer. You may save a life, yeah, but then they have to go under an anesthesia, surgery, chemotherapy, radiation. So you end up killing a person. So the only way you can sit back and say that a screening program is worthwhile is, as I showed you, you do a randomized control trial. You screen one group of people and you leave another group as a control. At the end of your testing, you ought to find more people alive in the screen group, and you don't. Okay, that's my introduction. That's it, Heather. What did I do? I did that in 22 minutes, not bad.
Not bad.
So just to bring you up to date on a few of the things that have caught my interest. I've been dealing with this for 47 years. The truth don't change.
But people wish that it would.
That's why I keep telling you the same thing over and over again. And I've shown you this in terms of various important papers that came out last week. I'll show you next week. I showed you in terms of heart disease and et cetera. We'll go through various categories of illness. And I'll tell you, you really don't stand a chance because of the kind of treatment you're offered, because cash is king. The more money that can be made, well, you know what the story. It's all like in every business, it's the profit. All right, Heather, I'm done.
Okay, so this is going to be really hard for people to wrap their heads around because screening is huge. So let's see, someone just wrote in and they're like, I don't understand. So we shouldn't screen at all?
Correct. That's what I'm telling you, is that this is an effort with no outcome that's to your advantage. All right. So here you are. You're enjoying your family. You're playing checkers with your grandson. Everything's good. And I come as a physician and I knock on your door and I say, ma'am, you need to get your breasts checked. Or sir, you need to get your prostate checked. In that circumstance where I interfere in your life and offer you these screening techniques, which are supposed to find cancer early. I showed you it's not early. It's late detection. Without a doubt, these procedures ought to do you more good than harm. I just showed you the data. There's no survival benefit except for probably a sigmoid exam. It was just a study published it was published October 27th in the year 2022 in the New England Journal of Medicine, the first randomized controlled trial called the Nordic trial on colonoscopy and whether or not it causes you to live longer. 10-year study, 58,000 people in Western Europe. The highest scientific methodology that is possible to use at the end of 10 years. Okay, October 27th, 2022, in the New England Journal of Medicine, at the end of 10 years, there is no difference in survival in those who undergo the colonoscopy and those who don't. So you tell me whether it's something you want to avail yourself to. Remember, you're enjoying your kids, you're gardening, everything's fine. And I come knocking on your door and I say, ma'am, sir, you need to be screened. What does screening do? It results in a huge net cast around a large population of people. It's the ultimate in disease mongering, where you turn people into patients. Look, I gave you the research. I gave you the data. I gave you the current studies. Now it's up to you to figure out whether I'm telling you the truth or not. And I am. And you're not going to find anybody who successfully argues against the real facts, maybe alternative facts, but not real facts. That's why I provide for you the science when we get together, not only in our 5 o'clock session every Sunday night, 5 p.m. Pacific Standard Time, do I provide for you the data. I mean, I gave you the research papers in the chat. I put the references down in all the slides. But when you come to us for care and to get well, we provide you with a very scientifically based program. And that is that we cure comorbid diseases. A cure, I mean, really like cure, like type 2 diabetes, obesity, constipation, indigestion. So if you want the cure, you gotta deal with the cause. And the cause is the food. And this nonsense of early detection. Yeah, you get your doctor or some fancy scientist to argue with me about this, but ask them to read the science first. They know better. They know better. The Cochrane collaboration knows better. Okay, Peter Gertzky knows better. You know, C. Barbara Miller and Charles Wright, very, very famous cancer researchers, they know better. But you and the public are being fooled. You're being asked to do something that results in more harm than good. The exception being doing a sigmoid exam. And I do recommend, this is what I recommend for colonoscopy. I recommend women not get screening mammograms, not do breast self-examination. In 2011, the Canadian Task Force on Medicine, in 2011, they told women to stop doing breast self-examination. In 2010, the U.S. Preventative Services Task Force told U.S. women to stop doing breast self-examination. It does more harm than good. Okay, so more harm than good is done with, basically every screening test that I can think of in this particular paper looked at, including lung cancer screening in smokers. All right, which is, touted, doing these early detection smokers. They didn't find a survival benefit. Only with a sigmoid exam. Why? Because when you do this 2-foot test in your rectum, that's 2 foot as opposed to 68 feet, where they perforate and cause bleeding and kill people. All right. This 2-foot tube, it finds most of the cancers finds most of the polyps that are likely to turn into a fatal cancer within the first 2 feet. And because it's a flexible scope, it's passed in the doctor's office, no anesthesia, no sedation, no pain. And they remove polyps, which are precancers. And so if you can do no harm, and you can remove precancerous lesions, then the patient is advantaged. But the problem is we do so much harm with these screening technologies. The runoff, anesthesia and surgery and radiation and chemotherapy, when you add the net value together, the only real meaning for, real value for screening technique is that in the intervention group, those who get screened, more people need to be alive at the end of the study than those who don't get the screening. And the data clearly shows this ain't the case, except for probably sigmoid exams. You end up with, a wash or doing more harm than good. So I think I was clear. Yeah.
It's
Show me how
hard for them to believe.
I know it is, but it's hard for you to believe, some of you, that starches are not fattening, or that meat's good for you. I know you. So there's some of this audience out here that has a lot of re-education to do. Anyway, what we do is we treat you based on science, based on the research, which is been accumulated over the last 100 years. And when we do basic studies, and they come to us basic, honest facts and conclusions, folks, the truth don't change. That's why I've been telling you the same darn thing for the last 47 years. I brought you up to date on heart disease. I've showed you why heart surgery doesn't save lives. I've shown you how type 2 diabetes is essentially 100% curable. I've given you the data. Come on now. You got to come back halfway now. You got to do some of the reading, to find out whether I'm telling you the real facts or maybe I've invented alternative facts. Well, it's up to you now. I've given you the truth. You're welcome to find whoever you want to challenge what I just said. I have to discuss it with them, but they know what I'm telling you is true, or at least the well-educated ones do. But it's not that there's not a lot of fighting that goes on because of these findings, because there's hundreds of millions of dollars at stake. You should just go to the internet and see the reaction that gastroenterologist colon therapists had to the Nordic study, which was a randomized control trial, the first and only one done, testing the survival benefits of colonoscopy, the Nordic study. The physicians and colonoscopy groups were so upset. They took a tremendous backlash, but they couldn't change the facts. They're still arguing about this. They're still upset by the fact that the truth is the truth. There's no survival benefit to doing colonoscopies, unless you happen to have some study I don't know about, which I don't think is the case. But I'd be glad to change my opinion if I left anything out. Hey, there's billions of dollars at stake here. What do you expect? Well, you expect doctors to be different than used car salesmen. Yes, again. These are people. They have to make profits. They put shoes on the kid, pay tuition. And in the process, they might find out that helping other people is a real big reward too. In addition to making enough money to pay the rent. Yeah, it's really a good thing to help other people, I think. And if you're going to be harmed by doing screening, put your effort into screening rather than dealing with the problem, which is the food. Then I'm here to tell you, you're heading in the wrong direction. Not giving you the facts. Look it up. Okay, Heather, please go on.
Okay, so many questions coming in. I'm having a hard time keeping them all straight, but the first one is about constipation. What would you suggest for someone that's eating this way, whole food, plant-based, but still is struggling with having regular bowel movements?
Okay, well, first of all, when somebody says they eat this way, I'm not so sure that they eat. There's so many people who think they're doing the right thing in terms of a recommendation there, but they're a bit off. They think, like, for example, refined food's okay, et cetera. You should expect a cure of constipation by following our kind of diet. What we have to deal with, and we deal with it every time we run a program, you have to deal with the fact there are a lot of medications like calcium channel blockers, these blood pressure pills that cause severe constipation. Also, you must understand one of the leading causes of constipation is dairy protein. Dairy protein, and you take the children or adults off of the dairy protein, and what happens is the bowel wall, which is being paralyzed by the dairy protein, starts functioning, and the bowel movements, become normal and active. If that isn't the case, you've gone off constipating medications, you've gotten the dairy, particularly the low-fat dairy, okay, because it's the protein that causes the bowel to be paralyzed. If you've done everything you can, then there's a whole newsletter I wrote. It is in my September 2002 newsletter. It's called In Search of a Perfect Bowel Movement. Like that? Okay, I've been at this for a long time. This is in September of 2002 newsletter on our website. In Search of a Perfect Bowel Movement. Tells you some things you can do to help. More water, more fruit. The only juice we serve at the program is prune juice to get people started. More Miller's Brand. What else, Mary?
Lactulose.
Oh yeah, lactulose. This is a doctor-prescribed medication. There are all kinds of relatively innocuous medications that you could take, herbal preps and those kinds of things that may help you also. But I would deal with those things first. The other possibilities you may have what we call a megacolon. In other words, you've been constipated for so long that your colon is stretched out and it becomes a floppy colon. And as a result, it doesn't contract very well. So in that case, you have to train your colon muscles to start contracting, and that may take a little while. And what you do is, like Mary mentioned, lactulose. We'll take and add a little lactulose. It's a non-absorbable sugar. No adverse effects, except that it makes the bowels move. And we give you a little lactulose and a good diet, and your bowels start having to contract. And over a matter of, hopefully days, but it probably will be weeks or months, the strength of the bowel comes back. And floppy colon or
Well, sometimes just
megacolon,
it's something as simple as whole flax seeds
yeah, you could do.
sprinkled on your cereal in the morning.
That would be another one. I bet there are a whole bunch of them I left out. That's just because I wrote it in September of 2002. It's in the newsletter. On the
Those are
website.
just some of the simple ones that we remember or that we talk about a lot.
Yeah, I just don't know.
No.
Yeah. That's what I would do. And you might consider, okay, I just want to add a last note here, which pertains to what we just talked about. If you are chronically constipated, you might have a problem. I mean, you could have a blockage, an adhesion, a tumor, even colon cancer. So
But then it wouldn't be screening
it
anymore.
wouldn't be screening. No. You got a problem. The colonoscope is there to provide diagnostic information. So it's not a screening colonoscopy. It's not taking healthy people and looking for disease. It's a matter of somebody who's got a problem and trying to find out more about what's the cause. And in that situation, a colonoscopy is an appropriate thing to do. So you want to have your bowel checked out to make sure there's not something underlying that's causing the problem. But you should expect, I wrote the only description I'm aware of a perfect bowel movement. I wrote it in a book called Dr. McDougall's Digestive Tune-Up. It's still a national bestseller. It was published in 2007. There sold thousands of books. And in that book, Dr. McDougall's Digestive Tune-Up, I talk about what is a normal bowel movement. A normal bowel movement should be soft, easy to pass. It's kind of light brown or darker brown in color. It should be kind of like a cow plop. It's not tubular. It's not like rock hard fecal marbles. It's not diarrhea. It's not explosive. And the whole passage evacuation should be in the matter of seconds, not hours, not 3 chapters of the Reader's Digest. It's just like you get in there and you just sit down, you just boom, gone. Anyway, that's what it's supposed to be. And as I say, I was bold enough, and I thought it was important enough for you to know what I considered a perfect bowel movement.
Thank you.
Oh,
I
by the
shared
way-
that link in the chat.
By the way, it occurs, it doesn't have to happen every day. It can occur daily or every 3 days or 3 times a day. They're usually in the morning. As long as it's not watery and explosive, I think you're doing okay.
Okay, thank you. Next question. Is there ever too much rice in your diet, or can there ever be too much rice?
Can't imagine.
It'd be really tough. Tough. In other words,
Even for the kidney patients that are really, really ill,
we put them on
we
rice
put them on rice.
and fruit juice and table sugar. That's the Kempner diet. I can't really imagine a situation where, particularly whole grain brown rice would put you in any situation. If you eat white rice, you could get beriberi.
But you have to add some
That's
fruit to the rice.
thiamine. That's vitamin B1 deficiency. You get beriberi from white rice. So there you go. There's a
But you'd have to remember to add some, if you only ate rice.
If you only ate rice, you get a little fruit, a little vegetable, you get all the vitamin A and C that you need, and B's and so on. So yeah, it's A and C. You got to add a little fruit and vegetable. But when they turn brown rice into white rice, they take the outer coat off, and in the outer coat is thiamine, vitamin B1. And if you remove the coat, and now you're just left with the nugget, you develop a condition that at one time in Japanese history killed huge numbers of people through problem called beriberi.
And
they fixed-
also, when you remove that coating, you're taking away some of the fiber, which could be a
not going to help with
constipation.
constipation. Yeah. So I just can imagine, just like, I've had people come into my office and say, Dr. McDougall, I think you got it wrong. You tell me I can eat as many potatoes as I want, and I'm not going to become overweight or develop any other problems. Really, you don't understand a compulsive overeater. You don't understand me because I got this psychiatric illness that causes me to be obsessive about food. And I say, okay, I do believe that some people can really push the limits, but I challenge these people every single time. I say, there's a bushel basket of potatoes. Go ahead, go at it. Come back in a couple of weeks and show me all the damage you've been done. And it never happens. So, except under the extreme behaviors that people might have, I cannot imagine doing harm by eating rice. And of course, your appetite's going to respond appropriately. After you eat enough rice or potatoes or corn, etc., you're going to shut down the appetite because you just ate what satisfies the appetite, which is sugar, carbohydrate. When I say sugar, I know some of you are sitting there thinking, oh boy, he just wants me to eat fruit juice and table sugar and candy bars. And no, what I mean by sugar, unless I qualify it, is I mean rice, potatoes, corn, etc. Starches. That's what I mean. Don't misquote me.
Okay, thank you. Are there any foods that we should avoid or eat to help with nerve damage?
Well, of course, your B vitamins are involved in nervous functioning. You want to make sure you get plenty of B vitamins, which it comes from vegetables and from the bacteria in your intestinal tract. They make B vitamins too. So B vitamins might be a good idea. Nerve damage, let's see. How about if it was due to diabetic disease? And you develop diabetic peripheral neuropathy, or you don't have diabetes and you just develop peripheral neuropathy. But I see both situations, people with diabetes or without, that develop diabetic peripheral neuropathy. In other words, nerve damage, the burning of their feet, pain. This is a really disturbing issue. And if you looked at my lecture on diabetes, where I talk about some of the complications like nerve damage caused by diabetes, you'll see 2 papers that show you that in some people, maybe half, this late stage disease, this nerve damage, maybe half, they get relief of this peripheral neuropathy. One study was out of Weimar. The other study was out the Physicians Committee for Responsible Medicine. And they both showed benefits in peripheral neuropathy. So a patient comes to see me, doesn't have diabetes, but still has peripheral neuropathy, same advice. Otherwise, I don't know any particular magic to help the nerves other than, dealing with the problems that I just talked to you about. And there is evidence that you get reversal of peripheral neuropathies and nerve damage by eating a healthy diet. Yes, you do. I've given you the evidence. I've given you the research. Now it's up to you to kind of look it over and see whether or not I've been exaggerating or not. I don't think so.
Okay, next question. This is from.
That's all right.
Oh, did you want to say something else? Sorry.
I don't want. She's gonna stop me from getting carried away.
Never. Okay, this next question is from Cardinalis. They have lost quite a bit of weight and now have a bunch of excess skin. So they're wondering if your body's going to absorb it or what they should do.
Yeah, Heather, did you? We got a letter in our email about, I forgot his name, but we probably shouldn't say it, who lost 150 pounds.
Yep.
And we've been taking care of him for about 20, 30 years. But people, we get, occasionally somebody who is really 150 pounds overweight and they lose the weight. And each and every case, what has happened is the skin has tightened up.
Sometimes it takes a while.
It takes a while, but plus you stretch the skin out enough, you have a bit of a hangover. What do they call it, Mary?
The
skin. No, the skin. I forget what we call
muffin
it.
top.
Oh yeah, muffin top. Yeah, that's
All
one.
right. Well, so you get this skin And listen, that may be the case, but you in most cases you can cover up with a shirt or a sweater. And if that isn't what you want to do, say you want to end up on the beach, you look good. Hey, there are lots of plastic surgeons out there who'd love to do a tummy tuck on you. No trouble at all finding somebody to take that extra skin off. If that's the greatest of the problems you have, I'm happy we did you a great service. Instead of end up with too much skin. Yeah. Anyway, we have, if you want to read the Star McDougallers, we have people, and again, we've been doing this for like 47 years. And we have, probably Heather puts up 2 or 3 of these a month at least, what we call Star McDougallers. And we've been putting Star McDougallers up for all the time we've been in business. And I want you to know, it's not like Jenny Craig or Nutrisystems where they say, this is the best case scenario. Don't expect these results. Ladies and gentlemen, you should expect the results that we suggest if you follow it. This is not the best case scenario. This is what happens to you when you fix the problem. It's just like if I said to you, okay, you got a bad cough, you're wheezing. If you quit smoking 2 packs of cigarettes a day, you're going to stop coughing and wheezing. Okay? How often do you think that my prediction would be true? It's the same thing with the food. Same thing with alcohol. If you say, okay, I keep falling down, breaking ribs and breaking my wrist and my elbows and stuff, and I drink, third of a bottle of whiskey a day, what do you think will happen when you stop drinking that whiskey? You stop falling down. Okay. So what I'm trying to tell you is if you fix the problem, which is rich food, the diet for kings and queens, you'll get these results. Essentially, everybody does, except you have to realize two qualifications Heather's going to jump in and tell us. One is, and this all happens within, say, about 4 months, you'll get better, dramatically better. One is there's some permanent damage done that's not going to be reversed. Like, for example, if you're an arthritic and you end up having crooked joints, pretty good looking joints, huh? These are 76-year-old joints. You may have deformities caused by inflammatory arthritis. It's not going to straighten out. Your fingers are not going to straighten out. Same thing if you have a heart attack and you kill a big chunk of heart muscle. It's not going to grow back. It's dead. Okay, so you can't be unrealistic with what to expect. You can expect that future problems will be reduced or stopped. The other exception that Heather's going to tell you, remember, I told you within 4 months you're going to get better. You're going to see the benefits like in, I don't know, 4 or 7 days they start. We were on a 12-day program. Within 12 days, we got 60 people in the current program. And we come to graduation on Tuesday. I bet there's not a single person who doesn't tell us a story of tremendous benefit for them. They didn't solve all their problems. No, they didn't. But in 12 days, what happened to them is modern medical miracles. And the healing time of the body is about 4 months. You get a bad car accident, somebody shoots you with a bullet. It takes about 4 months for the wounds to heal. So you should expect that the body will respond in a similar manner. It will heal once you stop the injury. Once you stop shooting bullets, the body will heal and catch up. Once you stop getting in car accidents, the body will heal and catch up. But if you continue the damage, like from the fork and spoon, or the cigarettes, or the booze, then your healing capacity, even though it's there and it's trying, your body never stops trying to heal. Be assured it never stops trying to keep you alive. It's called the rule of survival. It's just that the damage is so intense. It is so repetitive, so strong that the healing capacity of the body can't keep up. But when you stop the injury, from the smoke, the alcohol, etc., guess what happens? The miracle occurs. It's not a McDougall miracle. No way. It's a miracle of the human body. You are blessed by a temple with amazing abilities to heal itself and survive. Huge. I mean, just think about what your body has put up with in terms of abuse. Think about it. I'll give you an example out of my life. My body put up with 2 packs of cigarettes a day for 10 years. I put up with a third of a bottle of whiskey for too many days of my life. It put up with hot dogs wrapped in bacon and cheese. And it lived, survived. If you stop that kind of abuse, you can just imagine. You've got to stop asking the question, how much abuse can my body tolerate? And instead, you have to ask the question, how well can I get? How much return of health that I want can I get? But by stopping the injury, it's the fork and spoon. That's what it is. It's food. And we're here to teach you what we believe is the right food. Yes, sirree.
Okay, next question. Can you give us your opinion on healthy dry cereals, the legal ones?
Go for it, Mary.
Oh,
Shredded wheat.
well, yeah, shredded wheat
Cheerios.
or some Cheerios.
Some Cheerios.
There are different brands. Some of them are made with better ingredients.
Raisin brands.
Some of the raisin brands,
You gotta watch a lot of sugar in the oil in these dried cereals.
grape nuts,
Things
things like that.
grape
Some
nuts-
of the granola.
Grape nuts is actually a really low fat, no cholesterol food. So there are quite a few dried cereals out there. You want to make sure that you moisten them in a safe way. Okay. You say, well, what should I moisten them with? Well, not cow's milk. Do you have any suggestions, John and Mary, about what you do if you had to travel around the country trying to teach people about a healthy diet? And you had to stay in these hotels.
Where
And
where they don't have non-dairy milk available.
No. What do Mary and I do? Well, we go through the cafeteria line, or we tell the waitress we want shredded wheat or grape nuts flakes or some other kind of dried cereal. And you know what we ask for? Juice. Because juice, like apple juice or orange juice, it provides moisture and sweetness in a far better and safer manner than does consuming cow's milk.
And apple juice is much better than orange.
Yeah, apple juice.
I mean, just taste-wise.
That's the way we deal with it, is put something moist and sweet on top of the dried cereal, but not cow's milk. Good grief. All categories of food that I would list to be toxic and you to get rid of for your family's health, it would be dairy products, even greater than meat. It's a really big choice. I think the best way to understand it is what I've been describing for you is that dairy is liquid meat. If you look at the fat content of, say, a steak versus, say, cheddar cheese, they're both 70% fat. They both have the same amount of cholesterol. They both are carbohydrate, basically carbohydrate free.
But there's a lot more allergies to dairy,
right,
than there are than would to meat products usually.
Right. Particularly autoimmune diseases like nephritis and lupus and rheumatoid arthritis. Dairy protein is a real big culprit. So that's one reason. But the real reason that I'd ask you to focus on dairy before meat, and why I think it would be the best interest for you and your family, is because of your attitude. Your attitude about dairy is that this is health food. I need to eat this because it's got calcium and lots of good protein. Instead, if you were honest with yourself and understand the science, you'd say, why should I eat this yellow-colored block of fat that's loaded with leukemia viruses and bovine immunodeficiency virus and all kinds of other microbes and hormones and estrogens, and it just doesn't make sense. Give up the dairy first for you and your family, then get on with the beef and the chicken, the pork. Why don't you do it all? I mean, just go for it.
Just go for
If you
it.
want your health back, it's so much easier to do it 100%. Moderation kills. It's really difficult to be moderate. Like going back to my own example, when it comes to tobacco or alcohol, there's no moderation for me, ladies and gentlemen. And for you, it's cheesecake. There's no moderation. You have one bite and boy, oh boy, you never stop. One cafeteria, one buffet line after the next. So don't do it. It's much easier to say no. What did Nancy Reagan, the First Lady, say to the youths, the drug-addicted youths of America? What did she say? Take in smaller starts of cocaine? Just a little shot of heroin? No, what did she say? What did she say to the youth of America? And do you remember what Nancy Reagan said?
Just say no.
Just say no. She said, just say no. It's much easier that way. You know, when you're ready to have your health back, get yourself all set up, kitchen, etc. Or you come to our 12-day program. We'll every day for 12 days, we'll make sure you got things right. And then decide, look, I've had it. I'm tired of being sick. I'm tired of my personal appearance. I want to be different. Well, consider the fact that if you want to be drastically different, you need to make big changes. Big changes result in big benefits. Oh, this just makes so much sense, Dr. McDougall. It just makes so much sense. It's because I've been at this for so long. More than a half a century, I've been a medical doctor. I've taken care of more than 12,000 patients. I've written 13 national best-selling books. I've taken, care of people in live-in programs, hospital-based programs, et cetera. And I've had a team which has taken my little bit of contribution, knowing the science, and made this practical. Mary, who has published 4,000 recipes, Heather, who's put together the telemedicine program, so that you can take advantage of getting well. You want to get really well, then you make really big changes. So you don't just skin your chicken and buy skim milk to get well. You got to make a big deal out of this. And the big deal is you give up the animal foods, anything from an animal, muscles and lips and vaginas and tails and anything, secretions like milk, you give that up. Yeah, that's one category of food poison. And the other category is free oils, safflower oil, olive oil, corn oil. You just give that up. You say, okay, that's all I eat. That's my whole meal. I know some of you sitting there saying that. That's my whole meal is animal foods and oil. What do I eat, doc? Well, what you eat is what 99.9999% of people ever walk this earth consumed. And that is that essentially all large, successful populations of people. I'm talking about people who fought battles, who participate in athletic events, who had children, who watched them grow. I'm talking about people throughout all of human history. The verifiable data shows that they obtained the bulk of their calories from starch. Like, the Native American, it was potatoes and corn. The Aztecs and the Mayans, those are known as the people of the corn. The Incas, South America, these are potato eaters. The breadbasket of the world, they don't have a pork chop basket of the world. They got a breadbasket of the world, which is Ukraine and Egypt and Iran. And what do they eat in the Far East? Well, you probably know what we're talking about a little earlier, rice. But it's not been just rice. The Asian diet has been with sweet potatoes and buckwheat and all kinds of different starches. But it's always a starch-based diet. And it's just easier to eat a starch-based diet with a little bit of fruit and vegetable. Mary says 70% starch. I say 90. Okay, as you look at your plate, and yeah, right. Just get better. You got a chance. Got a really, really, really big chance. This is not the best case scenario. You should expect these results that we talked to you about. Hold us to it.
Okay, we have 1 minute left. You want to talk about what we have going on?
I certainly do, Heather. You're running a program right now. You've got how many residents, medical residents at the program?
8.
All right. So we take medical students and medical residents from various medical schools around the country. Loma Linda is a big participant. Oregon Health and Science University has sent people to us. There are a few other medical schools, and of course, we'd like to have more students. So right now we're running a program with 60 people with different problems, cancers, heart disease, and diabetes, and weight, and we're addressing all those problems. We start out in every day with our support specialist, which happen to be a couple of women. One's a nurse, the other's worked with us for 22 years. Start with your support specialist in the morning. We find out your blood sugar is, your blood pressure. We find out what you plan to eat during the day. And this support specialist follows you throughout the day. We have lectures. I have the opportunity to give 5 different lectures. Thank you, Heather. We have the smartest psychologist in the world, Doug Lyle. We have the best, most entertaining dietitian in the world, Jeff Novick. Jack Dixon, the best exercise person we've ever met. We got a staff that can't, we're there to address your problems. anyway, not only do we take care of you in 12 days, and the reduction rate in medication, basically 90% of people reduce or stop their medications during the 12 days, particularly diabetic and blood pressure medication. It's our data shows. And then after the 12 days, we follow up with you weekly and monthly for a year. You want a serious program that is reasonably priced. I mean, when's the next program you're going to run, Heather?
March 9th.
All right. We're going to have to add more programs. I think so. But anyway, we'll be back next week, Sunday night, if all goes well. And I'll share with you the things that I saw this week that support the fact that the truth don't change.
Perfect.
And then, although I'm a kind of an old guy, and most of the stuff that I researched was done, 20, 30 years ago, truth don't change. The current research says exactly what I've been telling you. I challenge you. All right. Good night. Good night. Good night, folks.
That's
See you
great.
then.
Thanks, Dr. McDougall and Mary, Mom and Dad. See you
All right.
all next Sunday at